And when we talk about hypertension in just a number basis, it's over 140 on the top and over 80 on the bottom, but it's usually indeed the silent killer. In fact, most people feel a little better when their blood pressure is a little higher for a while, instead of us giving medications that tend to make them tired. But you have to explain to them, for the long haul, we're trying to keep the heart from being damaged. I explain it to my patients is if I work out with dumbbells and start with 5 pounds and work my way up to 50 pounds, what would happen to my bicep muscle? And they agree that it would get bigger and thicker. I would say that's the same issue that's happening with your heart muscle. It's pumping up against a higher pressure and volume, and over time it gets thicker, but the cavity gets smaller. Now, they can dilate and get weak, but a large amount, 50% of our heart failure patients, get thicker and stiffer. So the analogy I give them is it's a rubber ball hitting a wall and bouncing right back. The blood comes into the heart, but then it bounces right back and returns to the lungs. Now, this is a simplified analogy. I think it allows them to realize I need to control my blood pressure now, because if I don't in 10 years, my heart will be thicker and stiffer, and I'll be dealing with a chronic issue for the rest of my days from there on out. Not only mention this, but high blood pressure is one of the leading causes of renal failure. And when you combine kidney failure with heart failure, it becomes quite difficult to manage the volume and fluid.